Hello my shadows, how's it going? Shadow Sick here, welcome back to Surgery Simulator 2013 DLC. We're on to the last surgery. It's the teeth surgery in space. So let's get into this one. I've got a good aura about me, pretty calm. Just breathe and I should be fine. This game has taken a toll on me. I mean, look, I don't know if it's in camera because I don't have my camera showing, but I got like a hole in my glove. So let's get into it. I'm gonna hang up this phone because I'm busy right now. You're gonna have to call me back. Sorry. Alright, so yeah, let's get into it. Alright. First of all, students, you need to, if you can successfully grab a scalpel, you need to cut the patient's, mask off. Not a shit. Alright, so you grab the scalpel like so. And you cut the mask off. You see he has ugly teeth. You get the scalpel out of your hand. If it gets stuck, that may be a problem. Just shake your hand a bit, you should be fine. Then next you grab, my choice is the giant hammer, if there isn't anything else in the way. You grab the giant hammer, if it will let you, and you smash the shit out of his teeth. Now the patient has an act, especially Bob, my example, has an act of keeping his mouth closed during the surgery. You just have to force it open with the hammer and it should be fine. Just whack it around with the hammer a bit. See, I got all his bottom teeth out. Just need to get the rest of the teeth out. Just thrash it like you're thrashing, you know. Alright, so eventually I will get all of its teeth out. And then we can begin the transplant of the teeth. If I can get that one tooth out. There we go. Okay, so he's losing 7 mils of blood. So what you need to do is you need to find the green injection, not the blue one, if the green one is in fact around. And, oh, there we go. And if you can carefully, without pricking yourself, stab him in the face to stop the bleeding. And you notice the teeth have started flying everywhere. That's not a good sign. My advice would be grab tweezers as soon as you can find some in space and start grabbing his teeth, because the tweezer is the alternate tool, is the best tool for the job to place his teeth in his mouth. Now, if you can move the fizzy pop out of the way, you grab, lean it down, and if it doesn't spam, it should grab one of his teeth. Watch out, the other teeth may start to float away. You start to, oh shit. Never swear and never let go of your tweezers. I just made that mistake by letting go of my tweezers and there they go. Because this game does that. I mean, the surgery, your hands tend to spaz out. I don't know why. Every doctor gets it. Your hand spazzes out and things go flying, wires get crossed and shit goes bad. Now, your mind has the ability to grab shit that you don't want to grab, so be wary of that. You may want to grab tweezers, you may want to grab a scalpel, but instead your mind will always grab the most unfortunate object you don't want to grab. Example, the beaker I just picked up before. You don't want to pick up the beaker because the beaker, you can't perform surgery with the beaker, and you want to keep that blue needle away from Bob, because if the blue needle goes near Bob, he's going to die, because that needle speeds up the blood flow, and you don't want that, or else he will die instantly. Now, if you can manage to grab one of these tweezers that are morphed into the bed, then you can continue with your operation. Now, I know you must be asking, Shadow, why are we performing a teeth surgery when we are doctors, not dentists? Good question. I couldn't answer that for you. I'm sorry, because I have no idea myself. So we're just gonna have to just do the surgery anyways. Now, if you can manage to keep Bob's mouth open, you should be able to successfully do the surgery. I don't even know why this is called the surgery. If the alarm clock gets in the way, gently press it out without knocking the teeth out of your tweezers, and then gently proceed on putting the teeth in his mouth. You may notice stuff starts to drift towards his face. That's only normal in this game because Bob's face is magnetic or something for some reason. You may see teeth floating around. Be careful to gently pick that teeth up if you can. I'm not that experienced with teeth as I am a surgeon, a doctor. But if you can manage to pick up some teeth that are floating around, that is a good sign that you're a good doctor or dentist in this matter. So teeth tends to fly all the way around the room. If you can manage to do a little catch and grab the teeth with your tweezers, you can push the teeth in. Bob looks absolutely fabulous. Oh, if there's ever a little pointy thingy sticking into Bob's face, just push it away. That kind of stuff cannot be tolerated in the workplace. Just got to pick up this. Now, be careful not to do what I just did. That is a big mistake. To move all the teeth to the point where you can't stick it in. Try grab as much teeth as you can, because teeth will be floating around. Bob tends to be an asshole and closes his mouth, which is actually really annoying for in my personal experiences, because you're trying to do the surgery on him and he's just making it difficult by closing his mouth. But if you play nice, he will cooperate eventually and you can continue with the surgery. Now, if you can successfully get shit out of his face, especially this alarm clock, all the alarm clock is good for is music. I personally find the music very annoying. But hey, shit happens. Now, Bob is being very impatient and annoying in this surgery today, people. He is constantly closing his mouth, which is making it very hard for the teeth to stick into his mouth. But eventually he will cooperate and we can move on. Now, you may notice that some of the teeth that I do need are flying around the room. If you can manage to get them, it is always a good thing. Because you want Bob to have the best looking smile in all of Surgeon Simulator, and for him to do that he needs to have all his teeth in. So if you can manage to get all the teeth in without scrambling around like I have, it should be a successful surgery. But as I said, the only issue I really find in this surgery is when Bob closes his mouth. That is a real problem. Or when the teeth drop out of the tweezer for some reason, just quickly pick them back up and drop them in his mouth. If it does not drop in his mouth, just pull back his mouth open if you can, if Bob cooperates, and well, if he cooperates, and Bob, please cooperate. I'm in the middle of a lesson here. It doesn't seem to be cooperating. He seems to keep closing his mouth. Eventually, you can manage to stick his teeth in. There is another tooth there. See if I can grab that. Shift his mouth back and place this hopefully in the top. Nope, it'll go in the bottom. Alright, that's not too bad. I ain't mad. If I can find another tooth, You generally need those big molars to be put into his mouth. Those are the main teeth you want to put in. But if you run out, I'm pretty sure Bob takes other teeth. Bob isn't too fussy. He said he wouldn't be too fussy with how his smile turned out. If you can not do what I do and make the teeth spread everywhere, the surgery should go smoothly. It's just a matter of Bob cooperating and making sure your teeth don't sink into his mouth. Now, his teeth isn't too far off of being done. All you gotta do is add a few more teeth in. If I can get these molars, I should be sweet. I don't think I did grab it though. Nope. The molars are the best teeth to have for Bob, because they're like the strongest teeth. But I'm pretty sure other teeth will work just as fine if you can manage to grab them with your scalpel. I mean your tweezers. What tooth did I grab? I think I grabbed a molar, but it went right through the tweezers. That's fine. It should still stick in. If Bob can cooperate and keep his mouth open, that's one thing that pisses me off about us. We don't have the right tools. So when you try to put teeth in Bob's mouth, we don't have braces to hold his head straight. So he's gonna move, and that's a real pain in the ass for us doctors, because we have not much patience on our hands, because we've got so many patients we gotta actually take care of, not just teeth, because we're not doctors. We're not dentists, we're doctors. But I guess the dentistry are just so fucking retarded that they decided to send Bob with his teeth surgery to us. So if I can manage to stick in a couple more teeth, he should be set. I know I'm missing that front tooth, and that kind of bugs me, because every time I go to put a molar in that front tooth, the molar would stick to the bottom, and that blue needle's going right for Bob, so we're just gonna shift that away, if it will go away. I think that's a molar right there. If I can grab that molar, it's slightly out of reach. I don't know why it is. Physics of this game is amazing. You Shadow should learn that. The physics of this game is so incredible, we just don't even know what physics is anymore. Now, it's a good idea to complete the surgery as quickly as possible, because your hands do tend to get sore from holding these tweezers constantly. So what you can do is you can just... Where did that stick? Okay, that went in his mouth. That's no good. If you can manage to get your tweezers in there, or get Bob to like throw it up, that's never a good sign. For some reason the tooth... Oh, and for some reason I lost track of my tweezers. For some weird reason. Let me get some more, because you can't complete the surgery without tweezers. Be careful though, you do tend to get a bit of blisters on your fingers from holding the tweezers for too long. And if you hold them properly, you notice that you can't grab them, because this game's physics are just amazing. You see how amazing this game is, and how that if you grab something properly, it won't grab it, but if you grab something in a retarded way, you'll grab it perfectly. Like how I just did there. Now if you can get Bob's fucking face open, I can find that molar hopefully, because that's what I need to complete the surgery. If I can grab a tooth of some kind, stick it in his face, then we shall complete the surgery. The only issue is not all teeth tend to cooperate. Some tend to just fly away and don't get caught in the scalpel. I mean in the tweezers, fuck. Don't swear. So, shit happens. I mean, stuff happens. I mean, if stuff doesn't hit Bob in the face, shit goes smoothly. Quite smoothly indeed. And if the teeth don't fly away, you're sussed. All I need to do is, believe... Oh, there's the molar. I wonder if I can grab it. Oh, and I let go of the fucking scalpel. I mean the... Why do I keep calling it a scalpel? I let go of the tweezers again somehow. And they stuck through my hand, and now they're gone. That's how easy it is to lose tweezers, my friends. That's how easy it is to lose tweezers in this game, because this game is fucking retarded. Oh, and the tweezers are stuck in my hand. That's new. Not. So if you can manage to get all the teeth in his mouth... Oh, there goes the molar just as I lose my tweezers. That's a common thing. The game tends to fuck around with you like that. If I can grab... No. Right, well, I can't. I was going to say, if I could grab these tweezers, I could probably grab that molar and put it in his face. But it doesn't look like that's going to happen. If I can get this beaker out of the way, I can grab these tweezers. And successfully complete this surgery. But it doesn't seem to be letting me grab them, only other stuff around it that are pointless to me. And the molar tooth is gone. If this problem occurs, just sit tight and wait. Something should come along for you shortly. If not, restart. I'm gonna wait, because I'm patient. I just need to get me some tweezers. There we go, that seems legit, right? Seems legit, right, students? Alright, so, let's look for a tooth to put in his fat face. All we need, I think, is one more tooth, is it? One? No, I think two. Two or three. Oh, I let go of it, for fuck's sakes. No, we only need two more teeth. If we can find two more teeth, hold the tweezers properly, because my fingers are quite sore right now. Well then we should have a completed surgery. It's only been 19 minutes, it's not too bad. Standard procedure of teeth surgery, especially in space, takes for fucking ever. I'm allowed to swear I'm head surgeon. Head dentist in this frickin' surgery at the moment. My fingers really hurt at the moment. Just give them a rest till you can find some more tweezers. Don't try grab the tweezers, because you need to give your fingers as much rest as you can. All I need is two more teeth and I'm done. And now he's starting to lose blood 1 mil per second, even though it clearly says loss rate is at 0. This game tends to do that to you sometimes if you're taking so long to do a surgery. Now if I can grab these correctly, grab a tooth of some kind, if this radio can get out of my face. If I can just grab this, or is that a broken tooth? I think it's a broken tooth. Let's try grab this one over here. Is this inverted? It feels inverted. Oh, there we go. Now, Bob, open up, please. I need to do this because your blood is dropping pretty fast. And I'm pretty sure you don't want to be the guy that dies from a teeth surgery. So shift your mouth. Oh, well, it fell in his mouth. That shit happens all the fucking time because Bob eats teeth. Because he's fucked in the head. Now, you can say this about your patient because the patient is asleep and cannot hear you. So you can curse at this motherfucker as much as you want. Alright, I think that tooth stuck in. Yes, it did. We just need one more molar. And we've sussed it. If only I can find a molar. Where is that last molar? I had it. Is that it? I don't think it is. Is this it? I don't think it is. Is that a molar in the screen? Nope, it's a broken tooth. Okay. So all I need is one more tooth, and I've done the surgery. I just need one more tooth. That's the only problem with this game. And with the surgery. You can't always get what you want. But you can try sometimes. You just might find it's what you need. My hands are getting very sore holding these tweezers, so I really need a tooth and stat. I would call my nurse, but I fired her ass because she's useless. Kinda regret that sometimes. Not that she's that helpful anyways. I don't know where that molar drifted off to. That one that I had in his mouth. Just need to stir up shit so I can actually get some teeth. Alright, so hopefully this tooth should do the trick. Yay! It did do the trick. I didn't even need a molar. Woo! He looks fine. Yeah, I got a D like I did in all the other surgeries, but I don't care. I fucking did it. Well, that, my friends, is every single fucking surgery and the Surgeon Simulator 2013 Anniversary Edition DLC. All the surgeries are done. All the hearts, all the kidneys, all the brains, all the eyes, all the teeths. All the surgeries are done, even the bonus ones. I did those in my previous episodes before the DLC, which is the Team Fortress and the Alien one. Done all of it. All done. Finished. So, please leave a like if you shadows enjoyed. Subscribe for more to help me a lot. And look forward to the testers coming out. I know I am. Love you all. Bye-bye.